Hello and welcome to Justice. I'm Judge Jeanine Pirro. Thanks for being with us tonight. An historic event. The CDC today confirming the first person to contract Ebola here on American soil. The patient who tested positive for the virus is a Dallas nurse involved in the care of Thomas Duncan from Liberia, who died within 2 weeks of coming here. Now, didn't they tell us not to be concerned? That our healthcare system was ready and capable? That hospitals knew the protocol? Healthcare workers knew what to do? They even told us that the chances of it happening here were infinitesimal.
First and foremost, I want the American people to know that our experts here at the CDC and across our government agree that the chances of an Ebola outbreak here in the United States are extremely low.
It seems, however, the only thing that's infinitesimal about Ebola is the amount it takes to catch it. Yet the Dallas hospital, a major metropolitan health center, sends a man home who tells them he's from West Africa, all the while presenting with symptoms consistent with Ebola. The hospital then sends him home, while contagious, to live in his family's apartment, which family then refuses to follow the health department's quarantine by sending their children off to school. And today, a healthcare worker, not even one of those prioritized by the CDC as at risk, who had all the benefits of the protective gear, has contracted the virus. Reminiscent of the doctor and the nurse who also contracted the virus in West Africa. They, too, using all the precautions and suiting up. Now, noticeably absent at today's press conference announcing this new case of Ebola was the CDC, yet they opined that there was a breach in protocol and that changes in the handling of such cases will be forthcoming. Wait a minute. Now you're going to make changes in a protocol that obviously wasn't working, that you said was working, that we were not supposed to worry about? And now I have to worry whether hospitals get the changes, understand the changes, and actually implement the changes. I'm not even convinced that hospitals have the protective gear for all those who could come in contact with the Ebola waste, whether it's the doctors, the nurses, or the maintenance people. They can tell you not to worry. They can tell you it's not going to happen. But the don't worry, be happy line doesn't work anymore. Start worrying. We have a problem, a potential crisis that so far has been screwed up twice. We have an issue. Can you really rely on our healthcare system? Can you rely on the CDC to tell you the whole truth? And if you haven't been worried, I think it's time. Tonight, we're going to hear from doctors who have differing opinions as to how easy it would be to contract the virus. Is your family at risk? Is one hospital better prepared than another? Can pets contract it? Can you contract it from your pets? And if you take one thing from this show tonight, it's that you need to take charge of your family's health care and not assume for 1 minute that somebody, anybody, has you covered. And that's my open. Joining me now, KDFW reporter James Rose. James, what is the latest on the new Ebola patient?
Well, I can tell you they are referring to that patient as patient number 1. As you know, Thomas Eric Duncan was patient 0, the man that originated the Ebola virus here in America. We do not know her name. We do know that she was a nurse that was in very close contact with Duncan while he was in isolation here. We do not know anything more about her condition except that Friday evening she had a slight fever and was exhibiting mild symptoms, Ebola-like symptoms, so she came immediately to the hospital, and we're told within 90 minutes of her feeling that way and taking her temperature, she was here in isolation. Now, you mentioned earlier that these folks are not at risk. Everyone in the medical field is well aware of the risks associated with this disease. These people were allowed to self-monitor themselves because they're healthcare professionals and they kind of look out for each other. And they were not part of the larger CDC group, the group of 48 people that were being monitored by the CDC. But the fact that this person contracted it definitely did send a shiver through healthcare professionals. But I can tell you she is here. We do not know her condition, except all they will say is she is stable. But at last word, we heard that she had mild Ebola-like symptoms and
well, the CDC today confirmed
fever. So.
The CDC today, this afternoon, confirmed that she did have it. But James, what I want to ask you is that headlines last week were the people in Dallas were, quote, sad and angry. How are people, not the medical people, but the population in general, are they worried?
People are concerned, and they're watching out. But as they've said all along, if you were not in direct contact with Duncan, you really were probably okay. And they've drilled that home. They even made the point where you might have seen Judge Jenkins, the man who's kind of heading up the Dallas County side of this operation. He actually drove with Louise, Duncan's fiancée, to a safe house where they're being monitored. He rode in the car some 45 minutes with him. He went into the apartment that was still being decontaminated. He did that to send a message that, the only way you can contract this is if you get some kind of body fluid on you. So they're pretty much sticking to that. And again, as you heard the CDC say today, they want to find out exactly what that breach in protocol was, because they're taking a closer look at everything from the time before you go into the isolation chamber, who's in the isolation chamber with you, and when you come out and strip off that gear, how is that, what are you doing with that gear? So they're going to be reviewing everything.
James Rose, thank you so much. And with me now, Fox News Medical A-Team members, Dr. Mark Siegel and Dr. David Samadi. All right, gentlemen, good evening. We've got Tom Frieden, the CDC director, who today announces he's got this new 5-part plan to prevent what happened in Dallas from ever happening again. Now, I want you gentlemen to think about this. We've got the Dallas hospital sends a guy with symptoms who says he's from West Africa home. Then we've got a healthcare nurse who is suited up wearing all the protective gear. She ends up contracting the virus, and now they have a new 5-point plan that they're going to implement. So here's my question to you. Are we just stumbling our way through this? I'll go.
You're going to start with me? Jeanine, Judge, listen. Fear comes from a lack of belief in leadership. And we have a situation where people are not being transparent enough with us. They're not being responsive enough, and they're not being responsible enough. I'm talking about the Centers for Disease Control right now. Now, I know the Centers for Disease Control well, and I think that there's a problem with them taking over this situation, because a lot of the errors that have occurred, and it doesn't really matter when you're out there worrying about errors. Errors make people afraid. I want to talk about fear in a second.
They don't make people afraid. Some people die.
Well, I want to get to that. But listen, no, they make people have a lack of belief that somebody can protect you. It's different. It's totally different. And I'm making a very serious point here. If you can't trust somebody to protect you, you think you could be next. It doesn't mean you're going to be next, but it means you feel that way because the person that's supposed to protect you isn't. It's a big distinction. Now,
I don't care about that. Here's the bottom line. What I care about, doctor, is whether or not the CDC knows what is going on. I'm not talking about fear.
They do. They know what's going on. They need to be more. I've talked to them. They need to be more transparent about it.
What are they not telling us?
What do you mean? What are they not telling us?
You said they have to be more transparent. What should they tell us?
Well, right now, I'd like them to come out with the name of the person.
I don't care about that.
What do you mean? I want to know who. I want her name out there so we can know who she contacted, so people out there can know if they were.
All right. So you're moving to the next group of people. Is the CDC being open with us and truthful?
Well, one thing I would tell you for sure is that I'm not a psychiatrist, and I'm not here to worry about fear. Even though it's an important part of this, we don't want people to panic. But we have to use this case of Mr. Duncan as a case report. From the beginning that he decided to come to U.S., he went through the screening. The questionnaire said, were you exposed to Ebola? We know that he was taking care of a pregnant woman who was extremely sick and died. The answer was no. Right there was a problem. Went through screening. We know that
he lied to get here. Fine. Okay, but he still showed up at the hospital with all of the symptoms.
Well, we're going to get to that. But the first 5 days, Judge, there were no fever. So he went through all 3 screenings. That's what I'm trying to tell you. The system is not ready to take care of these kind of patients and stop them where they need to be stopped.
Why did he go to the hospital in the first place? You saying he didn't have a fever?
He started having fever exactly 5 to 6 days after. He comes to the emergency room, and we're not really prepared. The travel history wasn't part of it. Has a fever of 103.
No, he told him he was from West Africa.
Exactly right.
All right, I don't want to keep going over the old stuff.
But listen, the AP got a report on this guy. I think the hospital totally screwed this up. Because they had a guy, and I don't think it's that hospitals aren't prepared. The guy comes in with 103 fever, abdominal pain, not urinating, and he came from Liberia, and you sent him home with an antibiotic?
All right, and let me tell you something, doctor. This is a major metropolitan hospital in Dallas, all right? We're not talking about, you know, some small town that doesn't have a lot of resources. That tells me we're not ready. It
tells me that hospital's not ready, and that's why I want the Centers for Disease Control.
And you know what I'm going to tell you, my friend?
Well, this is exactly what I said this morning.
It is? Let me tell you something.
That's what he said this morning. I want the CDC. Listen, this morning, here's today's lesson. Here's today's lesson.
Yes, doctor.
A nurse catches Ebola, taking care of a patient who has Ebola in a Dallas hospital.
Right.
With the Centers for Disease Control.
How did that happen?
Hold on a minute. With the Centers for Disease Control overseeing the situation, when they already know, and we already know from Brantley, Wright-Bull, that if they're very actively involved, they know how to quarantine patients.
We're going over the old stuff.
They know how to isolate them.
Here's where we are
want
today.
The CDC more involved.
I don't want them involved. I don't think they know what they're doing.
Who do you want?
I think when Tom Frieden says you can't get this if you're sitting next to someone on a bus, and if that person
she didn't get it that way. She's a healthcare worker. She was taking care of a sick patient.
No, I don't care. I'm talking about the CDC making. All right,
one of the things that came up that I asked Mark this morning was you have to explain exactly.
Hey, they're wrapping me up right now, but Dr. Siegel and Samadi, stick around. We're going to continue this conversation with more on tonight's breaking news on Ebola. And vote in tonight's Instapoll after hearing of the Texas nurse infected with Ebola. Are you worried now? Facebook or tweet me at Judge Jeanine.